Today we will be describing a case of submucosal fibroid. Patient is married for 8 years and this is the submucosal fibroid occupying almost 50% of the endometrial cavity. This is FIGO 0 to 1. FIGO 0 to 1 grading fibroid. So on 2D we can see a submucosal fibroid. This is the 4D 3D image of the submucosal fibroid occupying whole of the endometrial cavity. Afterwards this patient was taken for hysteroscopic removal of submucosal fibroid. So today she has come in the post-operative period and we'll check her uterine cavity whether there is any fibroid or not. So this is the uterus, this is cervix, this is the fundal part of the uterus, and this is the endometrial cavity. So no submucosal fibroid can be seen. Endometrial cavity is normal. We can see it was in the posterior wall of the uterus, if I am not wrong, if I do not remember wrongly. At the time of surgery you could see somewhere here was the fibroid, here was a submucosal myoma. So we can now see clearly there is no residual fibroid left. Let us check on 3D 4D whether there is any residual fibroid or not. So 3D 4D will give us a better picture and better visualization of the endometrial cavity. So this is 3D image of the endometrial cavity, 3D image. So let us see whether there is any submucosal component of the fibroid or not. So we can see no submucosal component of the fibroid is present. This is the endometrial cavity, perfectly fine. So endometrial cavity is perfectly fine. Submucosal fibroid yani FIGO 0 to 1 has been completely removed. No residual fibroid is left. In one sting it was removed with a resectoscope. So since the patient had a low AMH was 0.16 nanograms per ml, the patient was taken for PRP therapy in the ovaries in the same sting. Let us now check the ovaries as well. We can see two follicles developing, 1 and 2 in the left ovary. She had an AMH of 0.16. So let us check the right ovary. We can see one follicle in the right ovary. As soon as AMH improves around 0.3 to 0.5, we will take this patient for IVF. Again, we will see in the last to go 3D 4D image of the submucosal fibroid. So no such residual part of the fibroid has been left. In some cases, if the fluid deficit, if we are doing this procedure using glycine as the irrigating agent, then if the fluid deficit is more than 500 ml, the same procedure can be done in 2 sittings. This is the place where submucosal fibroid has been removed. Okay, this is the place where submucosal fibroid. Otherwise the cavity is perfectly smooth. Okay, done. Thank you.